Hello, my name is Dr. Andrew Papadopoulos, and I'm an associate professor within the Department of Population Medicine, as well as the coordinator of the Master of Health program within the University of Guelph. I've been involved in public health for over 25 years at various levels, including at the local level with the local Board of Health, at the provincial level representing and advocating for the 36 boards of health in Ontario, as well as within 2 universities. My area of research tends to focus in the area of environmental health, specifically food and water. However, given my involvement and expertise across public health, I tend to be involved in all aspects. Some recent research that I've conducted includes tobacco consumption, alcohol consumption, youth health, as well as pre-pregnancy maternal health. I'm also involved in research in pedagogy and administration within public health at universities. What I find most interesting about research is the unintended findings. When we engage in research, what we typically have an idea of what we expect to see. However, every once in a while, and in fact it's probably a little bit more frequently than that, what we find is that there are findings that are not what we expected. I'll give you one quick example. Recently, when looking at small drinking water systems across Ontario, we received data from the Ontario Ministry of Health and Long-Term Care. This data identified poor water quality results, and when we looked at those and the capacities of these various small drinking water systems, what we found were that systems that had water treatment devices had poor water quality results. Now, this isn't what you would expect. You would expect that water treatment devices would actually provide better water quality results. So when we investigated it further, what we found were small drinking water systems that had trouble in the past or had a negative water quality results installed these systems. Where individuals did not have any problems with their water, they did not install water treatment devices. So only systems that have had past problems have water treatment devices. And when operators were questioned about why they're still receiving poor water quality results, what we found was that these systems, or the water treatment devices, were not being maintained appropriately. So once installed, they felt, okay, now we're protected and we're going to have good water quality, but that was not the case. So that's an extremely interesting finding, and one that we're advocating to put into policy. My area of epidemiology tends to focus not as much on the distribution, but much more on the determinants of poor health outcomes. So I like to find out what is the cause of why we're having these not positive health outcomes or ideal health. And health can be very difficult to define. Some of the areas that I do investigate are areas around social determinants of health and the complex nature of what is health. So when we're looking at health and we're looking at epidemiology, and we try to identify those poor causes of health and what is causing those poor causes, and we continue to go upstream, what we end up finding out is that health is not just the result of one particular impact causing a poor health outcome. In fact, it's much more complex. In most of my areas, I tend to focus on a policy outcome as improving health. But when we look at policy, health in particular policy, we find that it's not just the purview of one particular agency or within public health. In fact, just about every policy we can name has some type of impact on public health. So policies in education, policies in finance, policies dealing with youth services, all have some type of impact on public health. So when we look at the complex nature, it's not that easy to be able to separate out these types of inputs or negative inputs into negative health outcomes. So that's where I tend to find most interest, and where I think epidemiology can have the biggest impact, is when we look at a particular health outcome. It's not simply say X will lead to Y, and if we stop X, then Y will be positive. In fact, there are many X's that lead to Y, and these X's have a very complex relationship. So it's not that easy just to stand up and say to someone, you know what, you probably shouldn't be smoking. We do understand that that is a negative health outcome, but people smoke for various reasons, and it's not just because they didn't understand that it was actually going to lead to poor health. So having a full understanding of the complete issue is what epidemiology can really bring to public health, and how it works hand in hand and together. I hope you found this very brief explanation of epidemiology and sort of my input into epidemiology interesting. If you have any questions about public health, or about the Masters of Public Health program, or about epidemiology in general, feel free to send me an email at papadop@uoguelph.ca. Thanks and have a great day.